Hello, the topic today I want to discuss is about endoscopy. So whenever I say you need to do an endoscopy, most of the people get scared. Oh, do I need an endoscopy? It's a very painful procedure. First and foremost thing I would say is no, it's not a painful procedure. It's not you do not worry or fear about the procedure. It hardly takes, if it's a very simple procedure, hardly takes 2 to 3 minutes, or even if you do some procedure, it may go up to 5 minutes maximum. Other procedures are entirely different, and most of the people again ask another question is, will you give anesthesia? No. First, no. Or there is no need. There are certain conditions where we give anesthesia. That is a different story. But generally, there is no need to give anesthesia. It's a outpatient procedure. You come, the procedure usually 3 to 5 minutes, and then you can go to job or college, or you can start your routine work, and you can start your normal diet after the procedure, 5 minutes after the procedure. And and most of the people think endoscopy means it's a huge big tube that no, it's like like your little finger, small tube, flexible tube, so no injury, no pain, nothing. And usually the preparation for the endoscopy is generally what they say is overnight fasting, that is 8 hours to 10 hours of fasting. But if not, you can do it also at least 4 hours of fasting. But that usually the physician who does the endoscopy, he decides, and they will say, don't take. I always say, don't take your sugar medicine the day of you are doing an endoscopy, because suppose for some reason the endoscopy gets delayed first, and your sugar medicine can bring down your sugar lower, and it will be very dangerous. And if at all, maybe if you want, you can cardiac medicines and BP medicines. We always say, suppose the endoscopy is around 8 o'clock, by 5 o'clock, or with sips of water, you can take your BP medicine or cardiac medicines, so that no undue stress is on the heart. So you can take your cardiac medicines, and also you check with the physician who does that. Suppose the endoscopy is done in the afternoon, evening time for some reason, for practical reasons, then you ask the doctor or even the nurse whether should I take these medicines or not. You should confirm with that. And again, anesthesia, there is no need. I always say don't, even if somebody gives, I always say don't take anesthesia. The reason being, if you are under anesthesia, the gut motility, certain findings we may not be able to see. Like suppose you have a acid reflux, a hypercemia, you may not be able to see because you are under sedation or anesthesia. These findings we may miss it. And but of course, anesthesia or sedation usually for children we always give, because they always keep moving, they will be crying, they will be, so for that part definitely they need some IV sedation or maybe anesthesia part. Or very old people, for some reasons, or the procedure is going to be a little longer. We are going to do some therapeutic procedure, like, or some foreign body removal, or maybe tumor embolization kind of thing. Then probably they may give a short anesthesia. So endoscopy, don't get scared unnecessarily. It has a lot of positive things and a lot of findings we can get from the endoscopy. It's a OP procedure, and you don't have to worry about the pain. There is absolutely no pain. And so I always say the trick of the trade, what you have to do to have a very smooth, easy endoscopy is, first is, I always say, don't breathe through your mouth, breathe normally through your nose. Normally we are breathing, the same thing you do. Out of fear, people do mouth breathing. That is the one which causes all the problem. First, so don't do mouth breathing. Two, when the tube goes into this area, always do some swallowing, as if you are drinking water, and you yourself can push the tube into the foot pipe. So that's the two things you can do. First is, don't do mouth breathing, and try to push the tube on your own by swallowing. These are the two things. And it's a OP procedure, so you don't have to worry about the endoscopy. Thank you.